I would dare to say that nausea and vomiting is not so common at the end of life. It is common at the end of life for specific diseases like any kind of stomach or gastric cancer, any kind of pelvic cancer, usually like ovarian cancer, or any kind of like metastatic colon cancer, any kind of tumor causing small bowel obstructions. All of those diagnoses can cause a lot of nausea and vomiting at the end of life. So with those diseases, when you do have a lot of nausea and vomiting at the end of life, I hate when I see someone having these symptoms because it can be so uncomfortable. There are a lot of medications we can use to help with nausea and vomiting at the end of life. I love to use suppositories, which is rectal medications, because one, it works really quick and it's usually pretty effective. When you're nauseous, when you're vomiting, you cannot swallow pills. And if it's really bad, we will use NG tubes, which is a nasal gastric tube that goes up your nose and down into your stomach. And then we'll place the tube onto suction to decompress your stomach. And that usually helps with the nausea and vomiting. But of course, there's the downside too. Now you have a very awful tube in your nose, and it's usually pretty difficult, if not impossible, to eat and drink with that tube. So there's definitely a risk versus benefit there. But I have seen that be the one thing that can really, really help end of life nausea and vomiting. Not ideal, but we will do it if we have to. Let me know your experience with this and if you have any questions.